Staying hydrated is important for everyone. We know water is essential for pretty much everything. 60% of our body is composed of water. So that is a lot, guys. Research shows that 75% of Americans are dehydrated, meaning 75% of us are not getting enough water on a daily basis. That is an astounding number because water is readily available and we know that obviously we need it for mostly everything. So guys, today we're going to talk about water and why it's important, especially for diabetics, and how water actually affects our blood sugar readings. So make sure you guys are tuning in because we're going to talk about all of that today. So guys, welcome back to the Voice of Diabetes. My name is Deanna and let's dive in talking about water, something that is so basic yet so important for all of us. So most diabetics know that water actually does affect their blood sugar readings. Drinking enough water is especially crucial as a diabetic. Even a little bit dehydration can cause concentration internally and therefore can actually increase blood sugar readings. And a lot of people who may not know this are very confused on why their blood sugar levels are varying from day to day, and that is actually just water alone can cause that difference on a daily basis. So you're probably wondering, well, how does this happen? Why does water actually impact our blood sugar readings? Well, when you don't drink enough water, the glucose in your bloodstream actually becomes more concentrated, and that leads to higher blood sugar levels. And of course, there is a difference between mild dehydration and severe dehydration. Mild dehydration is going to have less of an impact, although you are going to see an increase in your blood sugars, whereas more severe dehydration will cause an extreme spike in blood sugar levels. And at times I do have patients who have gone to the emergency room because they could not get their blood sugars under control, and then we found out that they were severely dehydrated. And if you have a stomach bug and you're vomiting and you're really not replacing those fluids, patients will call and say that their blood sugars are very high, and sometimes they go to the emergency room. Once they get a few bags of IV fluid, all of a sudden, magically, their blood sugars come down. And because we know that the source of the high blood sugars was actually the dehydration component that caused that, and that's why staying hydrated is very crucial and important for a diabetic and for all of us, of course, but this is geared more to blood sugar levels being elevated when we're not drinking enough water. So you're probably wondering, well, why is water important, not only just for blood sugars, but we know that water is very important for many different things. One of the Harvard studies showed that water flushes bacteria from your bladder. It actually aids in the digestion of meals. It prevents constipation. Normalizes your blood pressure. So not only does it normalize your blood sugar, but it also helps normalize blood pressure. It maintains a stable heartbeat. It cushions your joints. It protects your organs and tissue from a variety of potential damages. It regulates your body temperature and actually maintains your body electrolyte and sodium level. And of course, that is when we're drinking adequate amount of water. Water is also linked to weight loss. So of course, a lot of diabetics are always trying to maintain, and they should try to maintain a good weight. And there's a lot of theories behind it. I actually do not know what the right reason is, but I'm assuming that when we're drinking water, we're trying to be more health conscious, and therefore we're getting rid of the extra sugars in our life, such as juices. So whenever we're reducing the amount of calories and sugar we're putting in, I think that obviously leads into weight loss. So there might be a potential theory behind it. Other theories are drinking more water might boost your metabolism and cause you to burn more calories. So that's actually good. Drinking more water might help you reduce cravings for not so healthy foods. And I actually think that's true because I try to stay very well hydrated, but I notice that on days that I don't drink as much water, I crave more unhealthier option foods, like more snacking. And on days that we tend to hydrate, we tend to crave less of that. So I can see that theory actually being correct. And then drinking more water in place of diet soda obviously helps reduce insulin resistance. I have a whole video on diet soda even though, you know, patients say it has zero sugar, believe it or not, it is linked to more insulin resistance. So that's why we definitely have to start getting rid of even the diet things that we incorporate in our life as diabetics, because it does cause more insulin resistance, which in turn causes higher blood sugar levels and more weight gain and much more. So make sure you guys watch that video on diet soda versus regular soda, because it's actually a very eye-opening video and I think you guys will enjoy it. Well, how much water is actually good for us? How much water should we drink? And that's a great question, because you might be drinking a couple glasses of water and you might feel fine with that. So of course you want to know exactly what you should consume. So let's talk about that, guys. Drink 8 glasses of water per day. About like 6-ounce glasses would be fine. Of course, we know that, you know, depending on the weather, if it's warmer outside, we need to be more mindful and drink more. If your activity levels are higher, of course you want to drink more. So normally the recommendation is every hour you should take a few sips. And of course you always want to monitor the urine color. The more concentrated your urine is, the more dehydrated you are. So you want to make sure that your urine is on the clearer side, because that's always a good indicator of how much water we're drinking. And of course, if your lips are very dry and you physically feel like you're not getting enough water, that's usually an alarming sign that you need to start drinking more water. Our skin is also a good indicator. If our skin tends to feel very dry and doesn't bounce back very well, so for example, you know, if you're doing this and the skin doesn't go back to normal very quickly, that's usually a good sign that we're not drinking enough water. So those are all very good clues that we can watch out for. So we know that, you know, water intake is good, and it's hard to kind of overdrink water if you're a healthy adult. We have thirst reflexes, but sometimes I do feel that, you know, we need to incorporate more water than we're always craving. If you're noticing those signs, and it's probably a good idea for you to start drinking on an hourly basis. And of course, replacing any other drinks with water is always a great thing. But there may be times where you are actually advised to limit water. Different diseases like kidney disease and heart disease, like congestive heart failure, you might have a limitation on how much water you can have. But of course, that is something very specific and you need to discuss it with your doctor, because at that point you need to follow those guidelines very closely. And the good alternatives to plain water, if you are not and you absolutely don't like water, I normally recommend carbonated water, like sparkling water, or even adding a little bit of a flavor. You can use lemon and put some lemon in your water to give it a little bit of flavor, or maybe a different fruit, just so this way you're not replacing it with very high concentrated sugary things like juices or sodas. I hope you guys learned from this video and the importance of why water is actually so important in our lives and why it's so important for maintaining good glycemic control. So if you guys enjoyed this video, please consider giving this video a thumbs up, share this video, and don't forget to subscribe and hit on your notification so that way you're not going to miss any videos I upload here on a weekly basis. I'll see you guys all next time. Take care.